Hey folks, I'm here today with Dr. Francis Lau from Health Information Science, and he has been very kind to accept our offer to talk to us today a little bit about his research. So welcome, Francis. Thank you so much for joining us today.
Hi, everyone.
And so, as you know, I'm going to ask you some questions about your research. And yeah, so let's just start off with our first question. And that would be, how would you describe your research to your neighbor next door?
So I try to tell people that I work on electronic health records. And when they say, well, what is that? Then I would try to explain that it's really about storing a person's health information, personal information related to health. And in our discipline, what do you call it, health information science or health informatics, it's really about the conceptualization, the design, the organization and storage, use, communication of health information in terms of clinical decision making or health decision making more broadly. I'll stop there.
Oh, and so do you work with like health authorities or doctors?
So it's a broad field. My work over the years have sort of evolved. So I don't know what you want, the long version or the short version. I'll aim for sort of a medium length version.
Cool.
So I started out working with a clinical decision support system. That was my PhD.
Right.
And in fact, it was in the cardiovascular ICU, looking at clinical decision support system, looking at therapeutic management.
Right.
And then because at that time I was at U of A and I was actually in the business school, I got a faculty position at the business school teaching management information systems.
Okay.
They said, well, what's that? You know, how can you be teaching this clinical decision support systems to business students? So I actually switched over to work on sort of administrative systems and starting to work on knowledge management.
Right.
And after a few years, and then I work on virtual teams and working on collaborative technologies and all that, because in business, moving towards sort of virtual environment was sort of the in thing, and working in collaboration using all kinds of different technologies. And then when I came here to UVic, again, I had to switch because people would say, well, what's this knowledge management and what's this, business information system? You're in clinical, health information science. So I have to switch back again to working on sort of health related information systems. And at the time, I initially worked on sort of cancer information systems. And then I switched to palliative care and end-of-life care because I started to work with some clinicians in the Victoria Hospice. Right. And it was really everything fell into place because that was sort of what I was trained in, looking at decision support, looking at how information and technology can help with decision making. And at the time, we were looking at a what they call the palliative performance scale, which is looking at a way of looking at people's functional performance. And as a way of determining, you can actually do survival prediction on that. So I work with the palliative care physicians in terms of trying to work out some sort of a prognostic tools. Right. And then again, I switched because after a few years, I was able to switch back to work on electronic health record. And I was fortunate enough to get a research chair, an applied research chair, funded by CIHR, and Influence. It was to do with looking at implementation and evaluation of health information systems, or electronic health record, if we want to call it that. Right. And so again, that's sort of another phase of my research over time, where I look at developing conceptual frameworks, methodologies, and also doing field studies around looking at the design, use, implementation, and also the impact of information technology. So the latest iteration, I switched again because I know, I still don't know what I want to be when I grow up. So what happens now is that I'm working with the sort of data standards and terminology standards. And interestingly, I was introduced to this notion of section gender Data Elements and the whole notion of sex and gender and sexual orientation by Aaron DeVore.
Right.
And he said, well, Francis, you got to work on this because it's important. It's huge.
Yeah.
I said at the time, well, how can it be huge? It's just one data field called sex. And boy, did he prove me wrong.
Yeah.
Then I looked into it, and now it's a big thing because in electronic health records,
right,
we basically are ignoring a whole bunch of individuals, people who are sort of what we call the non-binary, the transgender, because we basically have male, female.
Yeah.
And is that my bell that says I go on too long? Did you hear a bell?
No, that was just one of my bells. I have bells and whistles all around.
I thought my time's up. And I have to hang up. So anyway, so that was very revealing to me because I literally just sort of dived into it. Yeah. And I was we were fortunate enough to get a small grant from CIHR, from Institute for Gender and Health.
Yeah.
Funded a planning project. So we actually created a sort of an InfoWay sex and gender working group, and we collaborated with about 40 different organizations and community groups across the country, basically trying to look at how can we modernize sex and gender information practices. Initially it was electronic health records, but then we're now broadening it to digital health systems. So that work is still ongoing, and we're now still in the second iteration of it because we created an action plan laying out some high-level actions in terms of what can we do in terms of advancing or modernizing the sex and gender information practices. So it's more than just say creating more fields. Instead of male, female, we now have non-binary, and you have to separate out sex from gender. Yeah. It's more than that because it also you need to how do you actually educate people?
Yeah.
Providers, administrators, and even patients and families. You need to create that safe environment where people are willing to disclose their gender identity and sexual identity. Mm-hmm. So that work is ongoing, and now I'm switching again, going into social determinants of health.
Yay!
Because, who ever know?
That's my field.
5 years ago, I didn't even know what it was. So so now with social determinants of health, it's a big thing because in the States in particular, there's a whole big movement in terms of how do you actually capture social determinants of health and social risk. Yes. In terms of looking at the food security, housing security, and all these issues that would actually create structural inequities.
That's right.
And you may say, well, what does that have to do with health information science? Well, everything, because in order for you to actually know something about it, you need to be able to capture the data. Yeah. And if everybody's capturing all this data in whatever other codes that they use, we won't be able to compare. Yeah. So what we try to do is really trying to standardize the information, both in terms of the questions, asking people about their race and ethnicity, asking them about their gender, sexual orientation, and also employment status, financial status. All of these things, you need to ask the kind of right questions. And more importantly, you need to actually have the right kind of codes to store them so that they can be captured accurately, correctly, and be able to compare. And that's where we're at right now. And again, we're quite fortunate. We got the help of the Canada Health InfoWay, the Canadian Institute for Health Information, to help us, and also the Canadian Health Information Management Association to help us in terms of trying to, first of all, create a social determinants of health, or SDOH working group. Mm-hmm. Because again, we need to sort of get the conversation going. I mean, there's been lots of work happening over the last 20 years. We're definitely not the only ones working on it. But what we're trying to do is really try to bring that into the digital health system or the electronic health record. And perhaps that's where we can make a little bit of contribution because we're the information scientists. And that's what's keeping me busy up in that right now. I think I'll stop there.
Wow. Well, first of all, that's an incredible journey you've been on. You must have to pack a light suitcase because you've been going from one and then I went here, and then I went there. So that's you're obviously a nimble researcher with lots of different skill sets.
Well, the thing is that on one hand, you may think that, well, this guy just can't make up his mind. But then I actually spoke with some, leading health informatics researchers. And that's because those are the only people I talk to, right? And some leaders actually told me that, we work on a particular topic for a few years, hopefully stay ahead of the pack. And when people catch up, you move on to something else.
Exactly.
And I mean, I may not be leading the pack, but that was certainly new for myself. So I'm leading myself into some new area.
Yeah.
Then when I become good at it and be able to sort of make a small contribution, I think, well, I think I'm ready to move on to something else.
Yeah.
Because in a way, it's also, I hate to admit it, I'm totally opportunistic. People may say you need to have a strategic plan in terms of planning out your career and all that.
Yeah.
Well, in some ways, I have to go where the funding is.
Yeah.
Because when I went into palliative end of life care, that was when end of life care was a big topic. They were funding teams and projects and all that to do with palliative and end of life care. So I was fortunate to be able to do that. And again, when I switched to electronic health record, got the applied chair in eHealth, again, they were InfoWay and CIHR were investing into electronic health systems.
Yeah.
So in some way, you need to be strategic, but you also need to be opportunistic to go where the funding is.
Well, and with careers like ours, I mean, what a great opportunity that we can be involved in so many different and exciting projects, right? I mean, that you can take those opportunities and it keeps things interesting, keeps our jobs from being too boring. I do very similar kind of work. I just go where people point me. I just say, go there, Charlotte, go do that.
Yeah.
So given everything that you've done, what inspires you? Like, what continues to inspire your research? And
well, I think the discovery aspect is what excites me, because when I first started to get into sex and gender, for instance, and social determinants of health, I know nothing about that. And what I usually do, and in fact, I wake up at about 5 o'clock in the morning. I start working at about 5:30 and 6. And usually the thing I enjoy doing most is actually doing literature search.
Yeah.
Trying to find out, well, what's all the sex and gender and what's all the social determinants of health, or for that matter, palliative care and life care. And I started doing search and then I start reading up on things and it gets quite interesting, because I'm really able to try to apply what I learned, because I do quite a bit of a systematic reviews, evidence review and all that. And being able to apply that to a particular area that I haven't done before is quite exciting, because, okay, I can actually write something about that. So, so that was quite exciting. The discovery aspect is good. And the other aspect that excites me is, again, being able to make a small contribution. Even if it's people say that you're doing it wrong, at least I'm publishing something, and then at least it's getting a reaction from someone.
Exactly.
So I'll leave it there.
Yeah, no, and I mean, it's to me, it's obvious that we're just the way you talk about research, and the research you do is that you still are inspired by it. You're still excited by it. And I mean, that's what we want. We want for our graduate students, right? So to inspire excitement. So I know you work with lots of graduate students, and so what do you do to motivate your students? Like what kind of advice do you give them that you hope will motivate them?
Well, a couple of things. One is that I try to set a good example. I mean, you're bad when workaholics are calling you a workaholic. So, I mean, I send people email at 5 o'clock in the morning, and the students say, "Well, gee, you work harder than me." So that I think, in a way, I think it's a good thing, because you're setting a good example. Plus, you really need to be authentic. So I do try to sort of work with students and really try to help them. Some students are embarrassed to raise questions, and I mean, today I just got an email from a student saying that, I'm sorry, and I know you sent me some email with lots of detailed responses. I don't understand it, and I'm sorry to bother you again. I said, well, that's why I'm here, and so I responded right away. And that's the way I would like to see it.
Yeah.
Students always say, some students always say, well, you respond really fast within 24 hours, because in some cases they don't hear from the prof for 4 or 5 days. I said, well, I'm on email all day, and when I
Yeah.
see something, I do respond.
Yeah.
So that's one way. The other thing is, I try to, rather than motivating them, I really try to provide, hopefully, some guidance, because I mean, these days, because we deal with graduate students. Right now, I teach all graduate students. I used to teach undergrad as well, but I think they have the similar situation in that they're dealing with very many different things, work life, family life, and then, personal lives and all kinds of issues that they have to contend with.
Yeah.
So I really try to ask them, um, you know who you want to be, and know how to get there. And if you don't, let's work it out. Let's try to see, try. I usually try to ask some probing questions.
Mm.
Um, what do you want to be 5 years from now?
Yeah.
I mean, these may seem to be simple questions, but sometimes when students are really just so focused in trying to get their graduate degree, they say, well, I just want to, get the thesis done. I said, well, forget about that. Just imagine that you're totally successful. You got your thesis done and all that. What do you want to be? What kind of work do you see yourself doing day in, day out, that you wake up and get excited about? And you get the conversation going, and then you really then ask them, well, how do you think you can get there? Because again, you have to be realistic, juggling between family life and work life, and personal lives and all these other things. And so that sometimes helps. So
Mm.
I'll stop there.
Thanks. No, I mean, that's inspiring that we want students to be thinking beyond their degrees, beyond their specific project, because it's often, well, that's the nature of our work, right? Thank you so much, Francis. I do have a bit more of a personal question. We like to ask our guests just one question that gives us a little insight into their, who they are. And so my question for you today is, what's one thing you own that you really should throw out?
One thing I own that I should throw out. Uh,
Or
you
that's
stumped me there. I have so many things I want to throw out.
or someone else has told you that you should throw out.
Well, my wife keeps telling me that I'm past my best expiry date, so I should be thrown out. So there you go. I mean,
Your best before date.
yep, way past the expiry date. So I'm just lingering on. So someday I'll have to throw myself out.
That's a great answer. Thank you so much, Francis. This was really, I mean, for me, I've often wondered about your work because I admire you as a colleague. And so it was
I wonder about my own work too. Sometimes I have no idea what I'm doing.
really appreciate you being with us here today. So thank you so much for that.
You're most welcome.
Hi, everyone. Charlotte here. Very happy to be visiting today with Marcy Antonio, who is a PhD candidate in the Interdisciplinary PhD program. So welcome, Marcy.
Thanks, Charlotte. Great to be here.
Yeah, good to see you. Good to see you. Yeah, and so today we're going to talk to you a little bit about the work that you've been doing with Dr. Francis Lau. And so, yeah, maybe you could just tell us a little bit about the kind of work that you're doing with him.
That sounds great. Yeah, so I've been working on a couple of projects with Francis. One of them is around the social determinants of health, and particularly around sex and gender in digital health systems. So currently we just, in our systems, we tend to collect only one piece of information around sex and gender, and then it actually creates confusion within our system as to what someone's gender might be. So it can have a significant impact on care, whether people are receiving the right treatment. And then the other one is around how to integrate patient-generated data into clinic visits. And so these are things like quite often people are asked to complete surveys in a waiting room. And currently we don't have a good way of integrating those into our care systems. And so how can we integrate that into technology and into clinics so that patients' voices are being represented in their care?
Right. And so what role are you playing in those projects?
Yeah, so on the second one, I'm co-investigator on it, and I've been leading the project. So Francis has really been mentoring me along in how to take the lead. And then the other one, there's two projects I was part of with that. So the first one, I was a co-investigator and coordinated the study. And then the second one is through Michael Smith, and we're doing a knowledge translation. So I'm kind of a trainee / co-investigator on that one. So,
oh, that's awesome. That's really great when you can, be mentored through your PhD and your graduate work in general, but also be recognized for the contribution that you're making. So
yeah.
sounds like you've got a great mentor who's, including you as a co-investigator so that you can get that on your CV. And
yeah, it's amazing. Yeah, actually to be able to do that at PhD level. So yeah,
oh yeah,
definitely.
sure. Yeah. What do you find most rewarding about this kind of work? What do you like best about it?
Yeah, I think it's just from my past experience of working in the community and really seeing some of the health inequities. So being a part of system level initiatives now that can actually create change. Because before I worked at the individual level. And so it was constantly seeing things that needed to be changed, but not knowing even how to begin to do that. So yeah.
Well, that's great.
Mm-hmm.
What about, I'm assuming it's a challenging work too, right? I mean, it's difficult to make those kinds of system-wide changes and everybody's sort of just picking away at their own little rock.
Yeah, and it's so complex, right? Yeah, yeah, and because you might change something in one area, but it really has implications for others, and often I think priorities or even our perspectives are quite different, and so how do you balance all of that? Because I guess in like a policy level versus at the practice level, we have different initiatives. So, and we all want to come together, but we have different priorities, right? So, yeah, definitely.
Well, and then you add to that, you're doing this, in addition to your doctoral work, as part of your doctoral work. And so there's all of those different agendas that are at work at the same time, right?
Yeah.
Pulling you in different directions, and academia wanting some things from you, and then the research requiring that we apply, especially in health research, right? Do you
Yeah.
find that was a bit of a tension there?
Yeah, as far as you mean the timeline, or just more require? Yeah. Oh, go ahead.
Your own sense of balance, I guess, in terms of trying to make trying to create an impact with our work in health research.
Yeah, because you're right. There's times when there's so many things you could be doing. Like there's always a grant to apply for, there's always a journal to do, but is it actually getting into the changes you want? And so it can be really hard to balance all of that. And so how do you, and also I'm on a plan for the next stages while trying to complete my PhD. So how do you do all these applications while trying to get done, right? So yeah.
And so where are you in the process right now of your PhD?
Today officially, actually this is perfect timing, I sent it off, my dissertation. Yeah, so now I'm just waiting for a final date. So I'm hoping
so you're going to be defending that. So
I'm going to be defending soon. Yes.
Wow, congratulations.
Thank you. Yeah, it feels really good.
Great accomplishment. And so lots of folks know what it takes to get that work done, particularly when you're also working on separate other research projects. So
yeah,
that's awesome.
No, it feels really good. So
So what's your dream? What's your plans for the future? What are you hoping to do afterwards?
I want to continue on research.
Yeah.
I'm not sure what that will look like, but what I've been bringing together is health equity, digital health systems, and then also I really like mixed methods research.
Okay.
And then my focus for my PhD has been working with this COPD populations, so people with chronic obstructive pulmonary disease.
Right.
So if there would be a way to bring those all together, that would be my ultimate, goal too.
Very cool.
Yeah.
And so are you planning an academic career, or you're not haven't
I'm
decided?
keeping my eyes out. So I would like an academic career. I might do a postdoc next. So I put in a few applications for that, and I find out soon if any of them anything comes from those applications. So yeah.
That's great. That's great. So I'm just going to add a quick question to your interview that I haven't added to most of the RA interviews, but just wondering if you had a piece of advice to pass along to other students that are thinking about pursuing doctoral work. What advice would you give them if you had the chance?
Yeah. For me, I think I was really lucky because I got to go to multiple conferences. So I went to, I think, 7 international conferences. And the workshops were so important because you get to sit in on leading researchers in the field and to be trained by them. And so some of the people I was reading around, I actually attended the workshop and even presented. So that I presented to the person who I designed my methodology around. So having that experience, but so and to go follow those the things that are in addition to your dissertation work, because it just has added so much richness to my program. So,
that's great. That's great advice. Yeah, so seek out those opportunities. That's great.
Yeah,
So,
I don't know if it's possible now, but even online, it is online actually now. So it might even be more doable, right?
Yeah, and we're coming back, and I suspect we'll do more blended opportunities. So I think more students might be able to attend those things in a blended sort of way.
Yeah.
So you know that we have a little extra question for you that is more on the personal side. And so my question for you today is, what is the weirdest thing you've ever eaten?
I would say century-old eggs when I was a kid. Yeah, I think I was like 8, and and I didn't know what they were. But I was a kid, right? We didn't. Yeah, I probably would be okay now, but I remember because I pitched that they were 100-year-old eggs, right? They weren't. I think they're 3-year-old eggs. So I was picturing that as eating. Yeah.
That's still old egg.
Yeah. Yeah.
That's an old egg. Wow.
Yeah.
Wow,
I think they vary. I don't know. I looked them up later, but I'm not sure how they make them. But yeah, I think they
ferment them or something.
I think so. Yeah.
That's a little bit disgusting.
Is that Kathy knows? Yeah. And then I was probably around the same time I thought I was given grasshopper pie, which is just like mint ice cream or something, but I thought it was grasshopper pie. So all these things that people were giving me that I took literally, right? Yeah.
Oh, that's fun. Listen, thank you so much. Really appreciate you taking the time with us. And it was really good talking to you. And I just like wishing you all the best, especially with your dissertation defense. I know it'll go great.
Thank you so much.
Yeah.